Well, I realize that was a lot of information right after lunch, but I'd ask first any members of the forum reactions, thoughts, comments. It's a bit overwhelming. Go ahead, Zuvi.
Thank you. I mean, firstly, I think it's brilliant, absolutely brilliant. This is clearly a huge step forward. But I do want to point out something that we probably ought to prepare for right now as we move in this field. So we have reasonably good information for children under 5 for a lot of the mortality, less so for morbidity, and therefore linking interventions and strategies to that age group is not a huge challenge. Then we jump from the under 5 to principally late adolescence. So then we have information for 15 plus, the lower end of women of reproductive age. We have very little data for under 15s beyond for certain indicators. So in the global burden of disease work, and particularly around the epidemiology of major causes of morbidity and mortality, at the moment the school age group, 5 to 15, and especially 5 to 10, is a complete void. In many countries, I mean, Mickey's left now, in countdown, of the 75 countdown countries that we have virtually no information on major envelopes of child mortality, or for that matter, morbidity between 5 and 15 years of age. I think this is a huge gap. And as you begin to now transit from under 5 to school age interventions, you will very soon face a dilemma that you have the interventions and you have some of the indicators, but you have nothing in terms of policy relevance of that to many health and nutrition outcomes. Let me just finish by saying that in our current surveys that are taking place, and I'm particularly looking at my UN colleagues there, there seems to be this tendency of here is children under 5, and then we jump straight to adolescence as if nothing exists in between. And that's largely a programmatic gap because the health and education people don't talk to each other enough. And if you're thinking of integrating health and education platforms, then investments in filling some of that gap around epidemiology in that age group is critically important.
I think that's an excellent comment in terms of when we are thinking about our measurement framework, and when what you mentioned, immediately it came to my mind, the school health surveys that are being conducted, but there is no link to the education sector surveys and how they are, and there is data that's coming out of those school health surveys. And I think what we could do is link up and expand the scope of those school health surveys and see how key indicators are integrated in terms of the coverage of the interventions that we are talking about. So there are different platforms. What we need to say is think in terms of those frameworks, and that we can use these different platforms and link each of them together.
I think just reinforcing this comment, this is why I think we have to be concerned now when we have data issues and measurement issues that are 0 to 3 and then 4 to 6, that we make sure we're harmonizing that, or we're going to get the same thing for the 4 to 6-year-olds. Go ahead, Jody.
Well, I'll just add my word of thanks to Zulfi's about a fantastic session. I love the fact that it balanced both this great comparative global data with the national deep dives and highlighted the gaps as well as what we've got. I want to, I guess, suggest that one of the things we have to do when we put this all together is link the data that we need to what we need to do to make change happen successfully in the field. And that's what I want to focus on. So if we want to have successful change, we've actually got to measure what people are doing to make the change happen. So we've got to measure policies, laws, and programs, so levers that leaders can pull to make change happen. We've got to measure implementation to see if it's working, and we've got to measure outcomes. And we have to do that across groups because of the disparities, whether that be socioeconomic, whether that be disability indifference, or any other disparity, as was highlighted before. There are a number of them. So I think we're much further on the outcomes data than we are on the law, policy, programmatic measures, and than we are on implementation. And I just think that's a really crucial gap if we're going to make change happen. But we have some opportunities to be fantastic in mix, which is such an incredibly important tool for all of us. If there was more implementation data, there are ways to make the UN data that's collected overall on policies and laws quantitative and measurable. So that's my main suggestion. Let's just link these to what we need to have effective action on the ground. Thanks.
An important point, Jody, and I know that we're going to try to make the effort. I know the World Bank and their sub-air efforts are trying to integrate the child outcome data into their policy reviews, and I think that's really critical. Rana, you have a... Go ahead.
Yeah, thank you. This is, again, it's been very informative, especially for someone like me coming more from the health sector side. You know, it's, I'm a little maybe overwhelmed by how many indicators there are. And you know, I'm thinking, maybe I'm jumping ahead already, but I'm thinking of implementation, and I see at least what's been presented, almost like 3 sets of indicators. I think Jody commented on them. So they're obviously, we need the outcome indicators, but I also heard about exposures indicators, and I didn't hear a lot about implementation indicators, which in our word, you know, like coverage, vaccine coverage, coverage of the various interventions. So I think we need to think about all 3, and you know, especially outcomes. But also, you know, to add to the sentence, what doesn't get measured doesn't get done. What doesn't get also understood doesn't get done. You know, I've heard about ECI, obviously, and I'd like, you know, Claudia to comment on, you know, how the data from some of the mixed surveys have been used for the childhood development. I remember I was actually working in Egypt a few years ago when the mixed survey results were released, and I remember hearing a lot about some of the other indicators for child health, but not much on the child development indicators, especially in the media, et cetera. And I don't know whether this is kind of a lack of, I guess, political commitment and will to actually act on these, but I'm just wondering how much of that is because there is no clear understanding, like what is the goal is globally. Thank you.
Lydia, do you want to comment?
Well, I would like to react to what Zulfia said in terms of the missing pieces. And there are plenty. There are plenty of areas and age group for which we don't have the data. But from the data collector standpoint, what is key is to understand what are the key information, key data that we need to collect at the international level in a comparable way in all the different sectors. Because as data collector, we constantly receive the requests for more data, better data, more coverage in terms of the country. So at a certain point, we need to be a little bit economical in terms of using these household surveys in terms of possible data collection, because the more we add to a survey, the quality of the information we get might deteriorate. And to guide the development of new questionnaires, we are constantly evolving in MEX in terms of adding new topics. We are now exploring life satisfaction, subjective well-being. So there has been constantly this process of evolution and methodological work that has been done. But as data collectors, we need a little bit of guidance from people involved in policy and programming to help us identify the 3-4 key indicators for which we need this data in a comparable way across countries. And then once we have this clear framework in mind, then we need to do methodological work to test, to develop, test, and validate cross-culturally measures. And this takes time and takes resources. But at least to have a little bit of an agreement of the core gaps and also what exactly we want to know for children between the age of 5 and the age of 14, because they are neglected. We cover education, we cover protection issues, we don't do that well in the area of health. What are the key measures of health, which we need to collect indicators and data in a cross-comparable way for this age group. This is what is gonna be needed, this sort of agreement of the key measures, and then we will need to do the methodological work that goes with it. In terms of the use of the ECD, well, we need sometimes to advocate for certain topics to be included in these surveys and also to be used when these surveys are released. In most cases, countries were very preoccupied when there are international goals, because they have to report on these goals, because donors pay attention to what the progress that's been made. So obviously, the MDGs have been a driving force when it comes to that. And most of the attention of the countries has been not only in collecting the data for the MDG, but also in being able to report. And as UNICEF, when we do the survey, we constantly advocate. I developed a new measure on child discipline. Countries were laughing. Statistical offices were laughing at first when we were saying, that's an issue. Slapping your child is an issue. So we need to know how widespread are these practices. So then countries have started collecting this data, and then they're not necessarily always on top of their priority for reporting. But there have been an increased awareness around ECD. And ECD indicators are among the most popular now, in 2014, indicators in mix. It was not the case when we first used them. So a couple of examples. To talk about the violent discipline, when the data were released in Serbia, for instance, an NGO together with UNICEF, they got this data into the news. It was shocking to see how spread was the use of very severe violent disciplinary methods in the countries. This led to the development of a legislation that was presented in front of the parliament. And we have other examples as well. But I think it's also up to researchers across the country to start using these data that are publicly available to do the analysis and make sure that the analyses are presented among different stakeholders. Thank you.
Anybody else? Go ahead, sir. Yeah, is there a mic here? Yeah, go ahead. I'm going to have one, and then we'll come back. Okay, go ahead.
My question is for Claudia, and it's a conceptual one with your summary indicator about children on track. What does on track mean?
If it's a philosophical question, I think it's going to take us another seminar probably to come up with a definition. It's very limited to the measures that we use right now in the mixed survey. So there are 4 different domains, and there is a questionnaire that is based on 10 items that check whether children are able to perform certain basic activities or functions. So for instance, in the area of social emotional development, for instance, we ask whether or not the child gets distracted easily. In the area of learning, we ask whether or not the child can follow simple direction or instruction. And on the basis of this different question, we construct the index. So children are defined as being developmentally on track if the mother reports that they're able to perform the activity described in at least 3 of the 4 domains. So that's a technical definition of being developmentally on track. These 10 items have been the results of a long series of methodological exercises throughout 3 years that were developed with testing and validation. So the results of this work are essentially summarized in this brochure.
Just follow up really briefly. I was just struck when you presented. Sorry. You need a mic. Graph on that you said over half of the children are on track, which sounded rather satisfactory, but didn't seem satisfactory at all. And so,
really.
You know, is the take-home message that, you know, nearly 50% of children are not on track? That's really alarming.
But absolutely was not satisfactory at all. It's not going to be satisfactory until 100% of children are developmentally on track. And obviously no measures, no matter how good the measure is, going to really be able to translate the complexity of child development. So it was very limited to the measures that we use. And I think 50%, that's not satisfactory at all. at all, absolutely at all. So I think it's probably a misunderstanding, or in terms of saying that it was positive. It's not positive, the picture, absolutely.
Linkage to our former panel here.
Hi. Yeah, I wanted to draw a connection between the electronically transmitted presentation by Abby Rakes and Claudia Kappa's presentation. The thing which I think somebody has already commented on and praised, that I was struck by in Abby Rakes' presentation, was that she recognized that there are complementary benefits of local design and international design. And I guess because we're an international gathering here, there's a lot of prioritization of what can be extracted, which is common across. But as you would probably have gathered from my presentation earlier today, I'm quite skeptical about some of this, and particularly when we start bringing in normative judgment. So this last question, I was tuning into the same issue that I was concerned about. I mean, on track, if we take a very simple example, you had the literacy numeracy data, and you showed that in a large number of African countries, very, very few children were on track. Now, we all know that in different countries around the world, the age of entry to grade 1 is variable, right? So, children in Sweden would be regarded as retarded by British standards because the age of entry is 7 rather than 5. That's an absurdity. It's got nothing to do with development. It's got to do with public policy. And so you're going to say it's on track and make the normative judgment. These children need help. All of them, they're poor little things they haven't learned to read yet. It's got this absolute misconception. But some of the other ones are much more subtle and will not get immediately detected, like the socio-emotional adaptation. There's some classic work done in the 80s by Jacqueline Goodnow on Lebanese origin and British origin Australians. The mothers having very different criteria as to what's an appropriate age for a child to be able to exercise various types of socio-emotional self-control. And as far as I can see, there's no solid evidence that one of those cultures is doing a better job at socializing its children than the other. And then we had a child left in inadequate care. Well, somebody's going to have to make that judgment of what is adequate. And if you train everybody to say, well, adequate means that the caregiver must be over the age of 15, then, you're going to have 90% of Zambian children will fail that one because, the caregivers are regarded as ready to do this by the time they're 8 or 9. So that's a cultural judgment again. And then perhaps the most controversial one has to do with this use of the term violence for corporal punishment. There's some fairly recently published work by Lansford and her colleagues, a multinational study, showing that the socio-emotional consequences of corporal punishment, which they documented rather carefully in each of these countries, are moderated by the perceived normativeness of corporal punishment, as well as by the perceived aggressiveness of the person administering the punishment. Now, these are not insignificant issues. In South Africa recently, some law was introduced where a whole number of parents were told that they were guilty of child abuse for administering what they regarded as being perfectly normative corporal punishment.
So I want to give our panelists a moment to respond. Larry, you want to add something before I turn to the panel? Yes.
Thank you, Larry. I just wanted to join two parts of the conversation. We talked early this morning, the very first conversation was about universality versus cultural specificity of intervention, of impacts, of risks, of the prediction of risks. Now we're talking about common versus culture unique metrics and measures. And 2 points. The first is I actually think we can inquire about these things. So for instance, you can use rich ethnographies to develop big item pools. You can then apply those item pools to multiple countries. You can do measurement in those multiple countries and see. And it turns out that there's probably some deep structure items that are fairly common, and some manifestations that are completely unique to culture. So this is a long-winded way of saying, are there any applied statisticians in the room? So the ability of we have to bring the best statistical knowledge to bear on this, because there are, I think, mathematical ways of, to some extent, to seeing how much this is true versus not. So it's a bid to move from principal differences, which are absolutely legitimate, to explore a little bit of a common ground. The final point is we're very, very weak actually in measures of context compared to almost everything, and in my opinion, because a lot of the things that are called measures of context are actually individual measures of perceptions of something. They're not measures of context. And so if we're going to do elegant work on the biology of development and outcomes, we have to do equally elegant measurement work on context.
Thank you. And Patricia, I think, was trying to make that same point. Any final comments from the panel?
Well, if I may comment on the ECDI, of course, the literacy and numeracy is the most sensitive to context and exposure. So it is a measure of exposure. It's not whether or not a child is able to, but whether or not a child has been exposed to a learning that privileges literacy and numeracy. So I fully agree on that. And we are currently doing methodological work on the ECDI as well to try to separate the exposure from ability, capacity, so that we avoid this sort of confusion. So your point is very well taken. Now, an issue of standardization versus customization. So I do agree that there are certain measures that are contextual, and we need to develop questionnaires that allow for customization, so that in countries the same concept can be interpreted in ways that are compliant with the culture. But that's customization of a tool. It doesn't mean that we're going to start developing country-specific measures, because then we are not going to be able to do some sort of comparison. And comparisons are important to distinguish individual cases from patterns. So the main challenge that we have is how can we develop a standard measure that then can be adapted to the local context, so that drawing a triangle can be relevant in New York City, but definitely needs to be changed into something that expresses this concept of this ability of drawing, but with something that can be relevant to the context of Zambia. And the last quick point I wanted to make on corporal punishment. It's a rights issue. It's not whether or not he has impact on the social, emotional capacity of the child. Children have the right to be protected from violence. It has an impact, it does not have an impact, that's not the issue. That's why we need international standards in terms of rights, because this has to be our legal reference.
Final comment, Taryn.
So coming to this concept of universality and the cultural specificity, that's an interesting discussion, and it can continue for days and days. But I think there are two aspects in there. That one is the issue of the assessment of constructs, and there might be universality around that. We also know that development is affected by contextual influences, and analyzing techniques and adjusting for these contextual influences can help us give some idea of the normativeness or the standardization. So there are ways and processes to get around this aspect of having something that can be universal. I think we do understand that in some manner. The second is coming back to Jodi's point, and I think that's an excellent point. We need to link data to change and action. And I think a range of indicators looking at the policies, how these policies are being implemented in terms of provision of services, coverage of different interventions, and what difference they are making. This is what actually we are looking for. So I think we do need that, and there the concept of universality really comes in. So I think we are not there yet in terms of measuring child development as we are for other indicators, but I think there is a consensus in the room that this is the way we need to go.
Well, thank you. Please thank our panel for their efforts in this work, and I think my own test about all this work is, will it improve the lives of children, and if what we're doing will not, then we probably should alter course. But in the meantime, we should go have coffee. Yes, it'll improve our lives.